Yeah, Michelle, they were supposed to get here at around 10:25 this morning, but instead they spent most of the weekend in Montana trying to process exactly what happened. Megan Vandervest says she was taking a nap when it happened.
Really, we didn't know what was going on for a couple minutes.
But she woke up to what she described as feeling like major turbulence on an airplane. She was on the Amtrak train heading to Seattle and was just a few cars up from where the train derailed near the small town of Joplin, Montana.
The car behind ours was like slightly off, and then the one behind that was kind of in between two sets of railroad tracks, and the one behind that one had like completely tipped over. I mean, that was completely jarring.
In part because this derailment sent several people to the hospital and killed 3 others.
We ask that people stay clear of the area until the investigation is complete.
Sarah Robin is the Disaster and Emergency Services Coordinator for Liberty County, Montana, where the train derailed. She said in a news conference this afternoon that they saw people from all over Montana come to help. And Montana Governor Greg Gianforte says only 5 people are still being treated in local hospitals.
At this time, I'm told all of the passengers that were on the train have been transported out of Chester.
On the investigation front, former Amtrak conductor Michael Callanan says it's going to take some time before we find out what really happened.
I would say up to 1.5 to 2 years. They are pretty much going to reconstruct the whole trip, the whole area of the trip.
While he has his ideas of what might have caused the train to go off the tracks, he says that lengthy process from NTSB's investigation will paint the most accurate picture.
It could be anything from the error of the crew to the track conditions from the other railroad.
Well, Steve, I spoke to Detective Sergeant here with the Des Moines Police Department. He does say this stems from an argument between 2 people that happened inside just after 2 o'clock this morning.
I woke up to gunshots. At first I thought it was fireworks.
Mallory Grobes is staying at the Red Line Inn just next to La Familia Sports Pub and came outside after those gunshots woke her up.
There was like 2 people on the ground over here, and I believe there was one maybe over there. I'm not sure, but I could tell the one guy was dead, but the other guy, he was still moving. Des Moines police say 3 people are dead and 3 others were injured after an argument started inside.
That dispute led into the parking lot with about 200 people coming out into the parking lot. People got into 2 separate vehicles, and as they were driving away, they opened up, both vehicles' occupants opened up fire on the crowd.
While the tragedy was unfolding, Grobes also worried for her own safety.
We staying on the 2nd floor up here, and we was scared it was going to hit us in our window.
Adis Yeshno runs a grocery store across the street. He says he wasn't expecting a deadly shooting to happen so close and plans on taking extra security measures for his own business.
I have a camera inside of the store, so probably I have to install for outside so then it can at least keep watching outside just in case something happens.
Now 2 bouquets of roses sit outside the bar. It was put there by a couple who says one of the victims who died is a family member of theirs. Grove says she'll still stay here, but is just praying for a peaceful night.
That was somebody's kid, you know, that was somebody's child. There's no reason to take somebody's life.
Yeah, one woman I spoke with was incredibly disturbed to see an image like a swastika in her town, and more concerned because it seems people are using hateful imagery to convey their opposition to getting the COVID-19 vaccine.
Brooke Hammett says she saw it on the side of Northeast Gunderson Road, just outside of Poulsbo.
I had just dropped my son off at school and I was driving home, and I saw that sign out of the corner of my eye.
Attached to a speed limit sign, she noticed a black sign with red lettering and what appeared to be a swastika.
I just was disgusted.
It wasn't until looking at it closer that she saw the tips of the swastika appeared to be needles, seemingly referring to the COVID-19 vaccine, with words "losing patience" below it.
People can have their opinion about vaccine mandates, but to use a symbol like that to get your point across is just crossing a line.
It's very troubling behavior.
Pam Keeley had seen Hammett's post on Facebook regarding the sign and went around Poulsbo as well and discovered another one on the other side of town. She understands that people may disagree with the vaccine mandate or the vaccine entirely, but she says this isn't an effective way to get that message across.
Those signs don't work to help the health of the community, the public health situation.
Both she and Hammett took matters into their own hands and took the signs down themselves. But they say there have been similar ones spotted in Suquamish and Bainbridge Island.
It's kind of crazy times and crazy thinking and ideas coming together in all sorts of ways that don't make sense.
Now, this all happened around Wednesday, so by the weekend, we weren't able to see any of the signs up. And Keeley hopes it stays that way.
Hopefully that was just a little pop up and now it's pop down.
So nurses I talked to say they are seriously burned out and they'll take any help they can get, even if that help comes from volunteers.
I was taking care of 2 patients that were both what we call one-to-one.
Alvaro Sario is a travel nurse at Swedish Hospital. He's been here since March. He's in the surgical medical ICU and he has definitely faced burnout.
I can imagine other nurses that can feel the burnout that I felt in that shift.
For more than 18 months now, our hospitals and healthcare staff have been overwhelmed handling the impact of the COVID-19 pandemic. It's so serious now.
So this is the worst Seattle has seen.
Washington State Department of Health is asking for federal resources to support healthcare workers. And now it's also asking for volunteer help.
We're reaching a point of just desperation in having to do things that are so out of the norm.
Washington is asking for licensed healthcare providers, those who are not practicing currently, and those who recently retired, to consider volunteering at understaffed hospitals.
We have massive burnout in our whole workforce. So people have literally left the bedside. Our need right now for staffing is at a critical level, what I would characterized as an emergency.
According to DOH, Washington State currently has a total of 136,244 licensed nurses. Of that number, about 3,800 are, quote, active retired nurses. Those are nurses who are retired but keep their license to help with short-term projects. Chris Martin spent 40 years as a nurse and was also executive director of Airlift Northwest. She's retired.
Have you thought about it?
I have thought about it. And for me, the biggest issue for me is that I'd be putting my grandkids at risk potentially by going back to work. If it becomes catastrophic, I absolutely would come and help how I could.
And DOH says that retired medical professionals can volunteer to give COVID-19 vaccines. Now, last spring, DOH reached out to retired nurses. These are nurses who have retired 3 years or less. There was a pretty good turnout. Now, if you want more information on becoming an emergency volunteer, we'll have that information posted on KOMOnews.com. Live in Seattle, Suzanne Fawn, KOMO News.
Hi, everybody. Thanks for checking out our YouTube page. I'm meteorologist Shannon O'Donnell from the KOMO Weather Team. You can see more of our videos right here by clicking on the video links for additional news from the Seattle area and Western Washington. Oh, and don't forget to click the subscribe button below so you don't ever miss our YouTube updates.